Between the Lines with Andrea Gilligan. This is Newstalk.
Coming up today, we'll be discussing the right to die. It's a long-standing debate, but one that continues to still divide opinion. So today we want to look into the reasons why. To discuss, we're joined, our panel this morning, the Director of Exit and European Coordinator, Tom Curran, Gina Menzies, Lecturer in Bioethics and Theologian, and Michael Nugent, the co-founder of Right to Die Ireland and also Chair of Atheist Ireland. You're all very welcome. Thanks for joining us this morning.
Thank you.
I might just start, Tom, maybe with yourself first of all. Just where are you coming from on this? Tell us about your own experience.
Well, I've been an activist all my life, but this is a subject, I suppose, that I never really came across. It's one that I suppose is relatively new as well, because it really came out of the fact that I suppose medical science now has brought about a situation where people are living longer. But because people are living longer, the chances of them having a good death or a difficult time coming up to death are much higher. And that coupled with, I suppose, the civil rights movement that really started in America in the 50s, 60s, started people thinking about themselves, and rather than being dictated to by other people, by governments, by religions, by groups, they started thinking for themselves. And this was one of the things that came out of that. My own personal experience of it came because 30 odd years ago I met a woman and fell in love, or we fell in love with each other. The difficulty was that Mary Fleming, people probably know of her, she had MS. And as her MS progressed, her life digressed. It was taking away her ability to do the things that she wanted. And she decided that she wasn't going to let it take control of her death. She decided that, knowing enough about MS, that the last years of her life could be very difficult and that she could have a very, very difficult death. And she decided that wasn't for her. She was a determined person. So that she brought up the subject, and that was my first introduction to the whole concept of the right to die.
And can I just ask you, Tom, at that stage, because as you said, it's not something that you had really put a lot of thought into, as many people wouldn't have, but when it was a conversation that I suppose first emerged in the house, what was your kind of initial reaction to that?
My initial reaction was that it was quite logical what Mary was thinking, that why shouldn't a person have a right to decide that they don't want a painful or prolonged or bad death? It's an individual person's life, so why should they not be able to decide how to live that, but also how to bring it to an end? I'm talking about rational people now. I'm pleased. The one thing that gets very, I suppose, mixed up with this, and it's put forward an awful lot, is that we have an unfortunate, I suppose, almost epidemic of suicides in Ireland. These are what I would term irrational suicides. So people that feel that they have no way out of a particular situation. But the situation that I'm talking about is where a person with an illness, with a long-term illness, thinks long and hard over a period of years, not just weeks or hours, over a period of years, about how they will bring their life to a peaceful end. And
it's to do with, I take from what you're saying, it's very much based on their medical state, I suppose, of their actual physical state. Well,
not necessarily physical. I mean, there are mental illnesses that do not prevent a person from rational thinking as well. So it's not just physical state. It's about the ability to think rationally and understand the decisions and the consequence of the decisions that are being made.
Obviously, your late partner, Tom, Mary Fleming, took a Supreme Court challenge to the current, I suppose, state of play in Ireland, and that was a decision, that was a position that she'd lost after being challenged in the Supreme Court. Where did you go from there?
Well, I mean, one of the things that we came across along the way, if that's the way to put it, well, first of all, when a person decides that they want to end their life, it's not very simple. Unfortunately, most of the irrational suicides are horrific. People throw themselves off buildings, people hang themselves. They are not very peaceful deaths. It's a very difficult prospect. Without getting the help of the medical profession, it's a very difficult prospect to provide a peaceful death to yourself. So part of the process was how do we go about this? Realising that it was illegal to get help from the medical profession or from anybody else. We had to go through the process of finding out how, which is where I came across Exit International. So I now continue to work because I know that there are thousands of other people out there like Mary who, to me, their wishes should be fulfilled. They are rational people. They are people who can easily make that decision for themselves and understand the consequences, but they need that help of how to bring this about.
Well, we're going to come into all of the nuts and bolts of all of this over the course of the programme, but I suppose just to give people a kind of an indication, if they're not familiar with your story previously, just your own kind of personal background, your own viewpoint on this. We've heard from you, Tom, just on the kind of initial introduction to this, but Michael, can I ask you the same question? Just where are you coming from on this issue?
Well, I have a pretty similar background to Tom in that I've been politically active all my life in campaigning on justice issues against terrorism in Northern Ireland, against religious influence on the state and issues like that. And my wife was also involved in those campaigns. And when she was diagnosed with terminal cancer, she decided that she wanted to be able to end her life in a way of her choosing at the end in order to avoid unnecessary suffering. And it was something that we had kind of talked about theoretically before, just as a couple. We'd been together 25 years, so you talk about all sorts of things. But it obviously became a more real issue when Anne was told that she'd 6 months to live. Now, as it happened, she lived a year and a half, so we got an extra year out of it. But during that time, the decision that she made to prepare to be able to take her own life if she needed to at the end, and the preparations that we made to be able to do that, and I had committed to helping her to do that if she needed to. Once we had made that, she had made that decision and we had made the preparations, her quality of life just soared after that, and she was able to fully enjoy, insofar as you can, the final year of her life, because she didn't have the additional psychological pressure of worrying about what's going to happen at the end. And I think that's the biggest misunderstanding about the Right to Die movement. It's that it's not just about the act of dying. It's about the quality of life that you have while you're still alive, by knowing that you have the potential to end unnecessary suffering if it comes to it.
Your wife, Michael, died in 2011. Am I right? Naturally, I should say, from terminal cancer, as you mentioned. Obviously, Tom would be very familiar in terms of the high profile campaign, the High Court, the Supreme Court, with the late Mary Fleming. Was that a campaign that you had looked at all, legally actually taking this on? Well,
not before, but we got involved once Anne was diagnosed, and Anne in fact saw that as her final political campaign herself. She did a documentary with RTA about it, and she was very strongly supportive of the campaign. Indeed, we met up with Tom at the time, and Tom, I remember the day that Tom met Anne, they just hit it off immediately. There's a kind of a sense of camaraderie among people who are going through this, because I think you kind of have to go through it to fully understand that it is an issue of personal conscience, of personal autonomy, and that regardless of what the law is, and I'm a very law-abiding person, but regardless of what the law is, on issues like that, when you are dying or when a loved one is dying, you're going to act in accordance with your own ethics and your own conscience, rather than be dictated to by whatever the court's like. Now, you would take whatever consequences that the law has, but I mean, it wouldn't stop you from doing what you feel is the right thing to do.
Yeah, we'll come to that in just a few moments, but as I said, just to give people a little bit of an insight into your kind of position on this, Gina Menzies, as a lecturer in bioethics and a theologian as well, just what's your perspective on this?
Well, I suppose it's at one level perhaps theoretical, but at another level quite personal, because my younger brother died of motor neuron just 6 years ago this year. And I always worried and wondered, if he asked me to help him, what would I do? And I suppose I'm lucky in one respect that he didn't put me in that position, because I still don't know how I would have responded. Thankfully, he died an easy death in one respect, in that he died at home, surrounded by his family, virtually pain-free. His mind was as bright as a button up to a few hours before he died. And I look at the hospice research, which kind of concurs with that. The Irish Hospice did huge research, and regrettably only 26% of us will die at home whereas most people want to die at home, surrounded by their family, pain-free, and a bit like my brother Frank, if you like, engaged up to the end. So in a way, he had an awful condition. He had it very young. He had a very young family. But it worked out okay, because he really never wanted to go. But interestingly, he had an advance directive. He had a living will. And he clearly, categorically, and we all knew, didn't want any what we would call extraordinary extended life treatment. He wanted to die when nature took its course. So, that's one level. And listening to Tom and Michael, when it's personal, you certainly look on these issues very differently. It's out there for most people. I'm fascinated by the fact that in Ireland, we handle death when it happens well. I mean, I've been at loads of wakes. Yeah. We actually do an awful lot of the ritual around death very well. But I also think we don't talk about it very much, and that not many people have thought about advanced directives or living wills as to the kind of treatment they want. Or I suppose living wills are primarily about withdrawing treatment.
And I suppose it's a subject that, look, people don't want to think about it, and people want to live.
It's never going to happen. It's never going to happen. So, and then on the other hand, I suppose I'm involved in teaching bioethics, where the autonomy of the individual, which is very much what Michael and Tom are talking about, is really preeminent. That no patient should ever have treatment done to them for which they haven't consented, and it must be informed consent. And I think Tom, focused on the incapacity. That's a whole other area that I think doesn't help this conversation. So, we allow and we encourage people to make their own decisions about their healthcare, and yet it seems at a critical point in their lives, we seem to pull that away from them. If they make a decision, a rational decision, as Tom said, that they want to end their life, that the law doesn't seem to be able to deal with that. Okay.
Can I ask you, Tom, just that point Gina mentioned there, the current legislation, what does the current law state with regards to this?
Well, the law that exists at the moment was really brought in 1993, when suicide was decriminalised or legalised, whatever way you want to put it. And obviously, suicide was a crime up to then. So anybody helping or encouraging or procuring, as the law states, the suicide of another was a crime as well, because obviously to help someone commit a crime was a crime in itself. But when suicide was decriminalised, this law was this part of the law was created that makes it illegal to assist a person in ending their own life, and it's very clear. It's just that it's a penalty of 14 years. I presume that the reason that it was brought in was really to protect vulnerable people, and that still is a grave concern on our part. That should the law change, there would have to be safeguards in that law to protect vulnerable people.
And for you, obviously, you were campaigning on behalf of your partner, and along with your late partner, Mary Fleming as well, Tom. But you were just state for us legally, because it can be difficult sometimes when you get into the legal jargon. What exactly was it that you were contesting with the law?
We were contesting with the law that the part of the 1993 Act that criminalises assisting a person suicide was against the Constitution, because it was a constitutional case that we took, and what we wanted was for that law to be struck out or to be changed. Now, the courts can't change the law; it's only the Oireachtas that can change the law. The situation in our case was that Mary was assured that she could have what she wanted. Suicide is not a crime. If Mary was capable of taking her own life, then there would have not been any issue. But it was very obvious that the MS was taking away that ability. So something which is available and legally available to every able-bodied person was now being taken away from Mary. So we argued that to give her back that right, she needed the help of somebody else.
And that's obviously where it became a criminal offence under the current
So really
legislation.
the case that we took was to protect me and to protect other people in similar situations.
Gina, you want to come in there?
Yes, I mean, I think the difficulty is you can talk about it ethically and legally, and I suppose, and I noticed or I remembered after Mary's case that I think it was Eamon Gilmore was the Taoiseach at the time, and he said, we need to have a conversation. about these things. That so much of our legislation has in a way been driven by the courts having to interpret something and then handing it back to the Oireachtas, and it's not an easy issue. But what I think is, in the UK, a similar case. There have been a number of cases in the UK, well documented. Debbie Purdy, she also had MS, excuse me, and she went to the courts. And interestingly enough, that was, I think, in 2010. And following that, in 2012 in the UK, the Director of Public Prosecutions introduced a series of, I suppose, reasons which would follow through the law and that people would be or would not be prosecuted. And it seems to me, I'd be interested to hear what Michael and Tom think, it seems to be quite a good framework. For example, they say the person who assists somebody mustn't be a stranger. They mustn't stand to gain by helping them to die. It can't be a person under 18. And a number of other factors, that it must be well established. In other words, it's not something that's decided on a day. There must be a sort of a record of somebody making that decision over a period of time. And even that the person who helped them, could argue alternatively with them. So there's 16 kind of well documented reasons, and it's interesting that nobody, as far as I know, in the UK has been prosecuted for assisting somebody to die. There was a really other sad case of a gentleman, Tony Nicholson, who had locked-in syndrome, and he went to court in recent years. And again, the courts really are very hesitant to rule in favour, and they ruled against it. Now, that man, again, there was a documentary, and he went home, and over 3 days he starved himself to death. So in a way, he didn't break the law, but he was denied any help to do what, as an autonomous, rational, independent person, he wanted to do. So I think the UK framework, and I haven't heard of any cases subsequently, but it seems to me a good place at least to start and to examine how we could frame some kind of law which wouldn't prosecute people, but there'd be very severe, if you like, conditions within that.
I'm just going to come to that framework in a moment. I just want to be very clear for people listening today. Are we very specifically talking about life-limiting terminal illnesses? In the case of where the person themselves decides that they want to end their own life, or that they want assistance. Is that, just to be clear?
That would certainly be where I would be coming from.
Okay, and Tom?
To ensure that people, weren't suffering, and that they're... Now, I think it is important to caveat for listeners that, Ireland has excellent palliative care.
Yeah, and we will... There are points we'll come to, but just, Tom, just briefly on that point.
Well... It's not an easy thing to answer, because the other situation that you're talking about, of people that haven't got illnesses, that's taken care of already. They can take their own lives anytime they want. It's perfectly legal. So for that reason, they don't come into this argument. We're talking about people who are incapable of taking that act themselves, or determining how to go about that, how to go about ending their lives to avoid a suffering. The other people, as I said, the 1993 Act took care of them already. So we don't need to bring them into this conversation.
And just, Michael, for yourself?
Yeah, well, Right to Die Ireland campaigns for the right of rational, terminally ill or seriously ill people to be able to make that decision. And we also strongly support the right to have palliative care if that's what you choose, and that there should be more resources put into palliative care. It's not an either-or situation. It's whatever the individual feels is most relevant for their particular circumstance. And there's one issue with regard to the court case that I think it's important to clarify, which is that while the court did find that there wasn't an explicit right either to commit suicide or to be assisted in committing suicide in the Constitution, there isn't that right as a constitutional right. They also found that the Oireachtas is entitled to create that right by legislation.
Yeah.
And they indeed encouraged them to do so. And they also strongly implied, in typical Irish nod and wink fashion, that if it was up to them, that they felt that the DPP would be likely to, I can't remember the exact phrase, but to look at whatever happened in Tom and Mary's case sympathetically.
Okay, do you want to come in, Tom, just on
that? They went even further to say that specifically in Mary's case, that if they could have done something that would allow Mary this right, then they would do it. but that wasn't within their power. Now, to me, that's very strange. That if one person, I mean, Mary was an exceptional person as far as I was concerned, but I'm biased. But Mary was just an ordinary person with MS. She was very strong-willed, but so are lots of other people. So if they felt that Mary had this right, and they were quite prepared to give it to her if they were capable of doing that, if the courts were capable. But if Mary has that right, why doesn't everybody else in similar situations to Mary have that right?
And that's a point that we're actually just going to pick up on, I suppose, the arguments really against all of this in just a few moments. You're listening to Newstalk's Between the Lines programme. We'll be back with more from our panel in just a moment.
Between the Lines on Newstalk.
Welcome back to Newstalk's Between the Lines programme with myself, Andrea Gilligan. On today's show, we're discussing the right to die. Our panel still with us today: Gina Menzies, lecturer in bioethics; Tom Curran, director of Exit and European coordinator, and also the chair of Atheist Ireland and co-founder of Right to Die Ireland, Michael Nugent. My thanks to you for all staying with us today. We set out, I suppose, in the first part of the programme today, just your own positions and perspectives on this particular issue. But there's a number of, I suppose, ethical and practical and religious and historical different reasons as to why people are completely against the idea of assisting in specific or certain cases with regards to the right to die. For a lot of people, though, Michael Nugent, I would think they're just terribly uncomfortable with this and feel that it's an area or an issue that could be abused in certain sections or parts of society if it was a case that we were to allow assisted suicide, or whatever title you want to give it. What do you say in those cases?
Well, the same arguments could be made, and indeed were made, about decriminalising suicide when it happened. People were concerned about that. But in practice, what that resulted in is people being more comfortable in talking about suicidal ideations that they might have had, because they didn't fear that by talking about it that they would be criminalised. And probably resulted in some people not committing suicide that might have otherwise committed suicide. The ability to, if you are deciding to do it, which is happening anyway, I think that's a very important issue. It's not a question of whether it happens or not. It's a question of how it is managed. And if it is legalised, it will be managed in a more appropriate manner, that you can bring in safeguards. It's also important to note that even now, you can, in effect, even if you're terminally ill or even if you're in a hospital situation, you can refuse to continue taking medication. You can, in extreme circumstances, people can just refuse to eat and drink, in which case they will die within perhaps 2 days to 2 weeks, but they will die in a pretty painful way.
But you can also, as somebody that has been diagnosed, with terminally ill cancer, that you don't want to, or even prior to that you don't want to engage with the treatment offering, or the various different treatments that that could be offered to you, even in a palliative setting. Yeah,
so I mean, all of those situations exist at the moment, and all of the concerns that people might have about formally assisted dying should also be concerns about suicide being legalised and about people being allowed to refuse medical treatment or to stop eating and drinking. But we don't stop people doing that, even though they're more horrific in some cases than assisted dying would be, because we recognise that there is an issue of personal autonomy, and that ultimately ethics, which is at heart, unless you have a particularly religious view that it's divinely inspired and you're told what you have to do by revelation, most people consider that ethics is about how we treat other sentient beings. It's about empathy, it's about compassion. And with regard to humans, it's about recognising personal autonomy in issues like this. Can I ask you, Tom, just about, I suppose, some of the counter arguments? You obviously, it was a very well documented. Mary's case and your own case was extremely well highlighted across all of the media at the time, and obviously subsequently afterwards as well in follow-on debates. But just give us an insight into some of the counter arguments you would have experienced from people.
Well, I suppose the main one that came up in Ireland was this whole concept of religion, God. God, for people who believe in God, that God is a supreme being that is the only thing, or whatever you'd like to call it, that has the choice of life and death.
So it's against the will of God?
Exactly,
okay.
Yes. Now, that is perfectly reasonable for a person who believes in God. But for that to be a valid argument, you have to believe in God in the first place. But even people who do believe in God maybe their God is a compassionate God, would wouldn't necessarily disagree with someone avoiding suffering. But that was one of that I suppose was the main argument that was put forward here. There were lots of counter arguments, and a lot of the arguments that were put forward were really the what ifs. This might happen, rather than any proof that it could happen. Whereas there is proof that where this has been brought in places like Oregon and Washington and now Canada, parts of Australia, that these concepts that people have of what might happen, there's no evidence that they do happen. So it's very easy to say that we might have a situation or this might happen. And that's a lot of the argument that was put forward against.
Just give us an insight into some of the other countries, just by way of comparison that you mentioned there.
Yeah, well, Oregon is probably a very good example. Oregon have had assisted dying for quite some time now. They operated on the basis of permission has to be given. In other words, a person has to make an application. They have to be tested to be rational. And that's the key issue in this. We're talking about rational decision, being able to make rational decisions. Then they,
as identified by medical practitioners.
Well, if I can go off on a sideline there for a little bit, one of the other arguments that was put forward, and that tends to be among the medical profession and the public as well, is that any person thinking of taking their own life has to be irrational. Irrational. That you couldn't possibly be rational if you wanted to end your life. Whereas the counter of that is that anybody who wants to take anybody else's life is assumed to be rational. If a person goes out and murders someone, they're assumed to be acting rationally when they do that, and it has to be put forward as a specific argument. So how can you be irrational in one sense of ending life because it's somebody else's, and irrational ending your own?
Just before I'll come to you, Gina, in just a moment, but just on that point, Tom, in a case where somebody is perhaps terminally ill with cancer and they're obviously taking, whatever type of medication and various different types of medication that you would take, and in some cases people can have reactions to that. A form of psychosis, manic psychosis, and perhaps their viewpoint, their thinking on it, their whole belief system can change, and I'm not necessarily saying it's because of the drugs, but since they're on whatever kind of drugs they're on, or perhaps they're taking a psychosis to medication or to their illness, their understanding or their want or their belief in this area might change. And how do you then distinguish between?
Well, the area that causes most concern is with dementia. That when a person is rational before dementia takes over, that they may make a decision that this is what they want. They want at a particular point for their life to be ended. But at the point that comes, they are incapable of rational thought because dementia takes away that capability. In my view, and this is just purely my personal view, I don't think it should be allowed in those situations. I think that at the time that the person is dying or wants to die, that they at that point have to be capable of rational thought.
Okay.
Otherwise, how would we know what they're thinking?
Gina, if you can, I suppose, simplify all of this, because it's a really complex issue for people.
It is complex, and I think it needs an awful lot more in-depth discussion, albeit we're all coming from a similar position. But just in relation to capacity, it is important to point out that in medical... first of all, I don't believe that all doctors would say that somebody who says they want to die is irrational. I don't think that is...
Sorry, that's not what I said. I said that's a view that comes from the medical profession. It's not all of them.
Oh yeah, well, I'm just saying, I mean, the medical profession doesn't, as a group, say that people who are contemplating suicide. I just, wanted to clarify that. And the other thing, I suppose, is that when it comes to consent or the withdrawal of consent, which I think we're all kind of at one with that, capacity is always assessed. And you're absolutely right, Andrea, when you talked about the impact of drugs. I mean, many patients would have what's called, in the medical area, fluctuating capacity. And they would also have capacity in relation to some decisions and not in relation to others. So, I can have a spike in my temperature and I can be, and I once had pneumonia and I think I was completely, irrational about everything. And I can remember it very well because the only time in my life when I felt my head was in some kind of different space. And I wasn't I wasn't wishing to die, but I certainly wasn't wasn't capacitated, wasn't rational. And yet, a few days later, I was back to whatever I am, whatever capacity I have. So I think we have to be very aware of that fluctuating capacity. And I agree. I mean, the dementia situation is hugely, I think, fraught, because, going back to the beginning, we said medical science and medical practice now can push out the boundaries of life to extraordinary limits. And I don't know if we really have had the right discussion about that. There is a huge reluctance, absolutely, on behalf of the medical professions. There would be many who would think that, death is almost a failure of practice.
Well, it goes against everything.
Yeah, because, your primary motivation, your primary objective is always to either, enhance life or extend it and alleviate pain and to do good. I mean, the benefit risk analysis comes into every single action that practitioners make. So I think, it is very difficult. But, the bottom line, I think we're still saying that people who, make a rational decision, should be allowed to make that decision because they are in relation to everything else in medicine. I mean, absolutely. I think, as Michael said, if I have decided at some stage I don't want any more treatment, because end-of-life treatment can be very tough, but if I decided I don't want it, that's my decision. I have capacity to make that decision.
And who decides on capacity, just to clarify, Gina?
There are a number of assessments. It generally would be a medical practitioner would generally look to a psychiatrist. It's not something that's done kind of lightly. It's not a tick box exercise.
I presume over a period of time.
It's an assessment, and that's why when somebody could refuse treatment today because they just feel I've had enough, I can't take any more, and yet if there's a lift, they could make a different decision tomorrow. So that's why there is now a lot of concern about advance directives and living wills, which I think are a very good idea, but they have to be very specific. Like my brother's was very specific. I have motor neuron. I do not want any extreme or extravagant treatment. I will die in my own time, in my own place. And he didn't want to go to the hospice. He was very clear he didn't want terminal sedation, which is another whole area. It's interesting that, in the Irish system, when people are under either physical or the mental stress of dying, they can have terminal sedation, and nobody ever queries that, because that is to alleviate, if you like, the physical and mental stress and anxiety that often, but not always, accompanies dying.
Can I ask you, Michael, I think for a lot of people, they would see the idea of, euthanasia or the right to die as kind of a slippery slope, that it would take advantage of people that are perhaps vulnerable, that it kind of lessens the whole idea of the sanctity of life, and just poses the question, ultimately, who has the right to make that decision? And I know that you've kind of set out your own viewpoint and opinion on that, but just with those kind of, I suppose, more practical arguments, the things like we have palliative care for people that are terminally ill, does this idea of kind of assisted suicide or the right to die, does that in any way make the idea of the palliative care, does it lessen what they do? Does it make it unnecessary if this was something that you think were to be introduced?
Well, no. Around the time that my wife was dying, my father was also dying. And he went to hospital. He wanted to have palliative care. He had a great service in the hospital system here, although we think that there should be, better resource palliative care generally in the country. And that was what he decided he wanted to do. And even though his family are strongly supportive of the right to assisted dying, there was no pressure put on him to take any other decision. He took the decision that he wanted to take. And my wife took a different decision. And so I mean, they're not mutually incompatible at all. In fact, they're supportive. In fact, ideally, the right to assisted dying would be part of the palliative care system for those who, at whatever stage, if they did choose it, chose to avail of that option. It should be part of the same system. And the other thing about the idea of the sanctity of life is that, again, it's not about the act of dying. My wife didn't want to die. She wanted to live as long a life as she could. Now, she wasn't afraid of dying, but she didn't want to die. But what she did want to do, once she was put in a situation where she was told that she had 6 months to live, is she wanted to have as full and as enjoyable as possible a life during that time. As it turned out, we got a year and a half of it. And the only reason that she was able to have that quality of life during the last year and a half of her life was because she had taken the decision and we had made the preparations for her to be able to end it in her own way if it reached the stage that she wanted to. And as it turned out, she didn't. She died naturally. And most people do. Most people who make these preparations end up dying naturally, because it's not about a desire to die. It's about the quality of life that you're given by not having the extra pressure of fearing what's going to happen at the end.
Well, just a point about that is quite interesting. The Dignitas, which does get a lot of coverage, and it seems to me a very cold. I've seen the programmes about it, but it is interesting that statistically, of every 3 people who apply to Dignitas, only 1 follows through. So I think this ties in, I think, something with Michael is saying, the security of knowing that I have another choice, I think is hugely, I don't know what the word was, helpful or supportive of people who have a terminal condition and who anticipate that there might be pain at the end, that they can know that they have another choice. And then I think they can sort of fall back, it was the right word, and enjoy the life that they had. Okay. Very interesting fact about that is that a long time ago, go back in Ireland, maybe even 40 years, if somebody had a terminal condition, they generally weren't told about it. And it wasn't just Ireland, actually, that's international, because they didn't want to upset people. And now, kind of in bioethics, it is the complete reverse, that unless somebody says, I don't want to know, and they're totally entitled not to want to know about their condition as well, but unless a patient has indicated that, they will be told what their condition is and their prognosis and all the rest of it. And the reason why is because that allows them the time. If you lie to somebody and saying you're not dying when you are, or that you're not really terminally ill, and then as time progresses they deteriorate, one day then they realise that they have been lied to, and I think that must be an awful revelation to people at the end of life. I suppose
though in some cases medically though, Gina, it's probably just, I would imagine, exceptionally difficult though for the medical practitioners to look at somebody's diagnosis and the prognosis. It is one of the toughest things that medics have to do, and in teaching undergraduates it's extremely difficult because they've almost no experience of what it's like. So breaking the bad news is a whole module in medical undergraduate education. We're just going to have to take a very short ad break here. You're listening to Newstalk Between the Lines programme. We'll be back with more from our panel in just a moment.
Between the Lines on Newstalk.
Okay, well, welcome back to the final part of this morning's programme, Newstalk's Between the Lines show with myself, Andrea Gilligan. Today we are discussing the whole concept of assisted suicide. In our panel, still with us this morning, Tom Curran, Director of Exit and European Coordinator, Gina Menzies, Lecturer in Bioethics, and also co-founder of Right to Die Ireland and the Chair of Atheist Ireland, Michael Nugent. I know, Tom, you just wanted to come in just briefly there, in a point made before the break.
Well, just on the Dignitas side, and Dignitas isn't the only clinic. There's Life Circle and several others as well in Switzerland, because the law, which we could take a whole hour to come into the whole law situation in Switzerland, but it's very similar to a situation that you were talking about earlier on about the guidelines in the UK. The big flaw in the guidelines is that's all they are, that the person has to commit the act first. They have to put themselves in a position where they may or may not be prosecuted before they know. And that's unfair, because the person then dies not knowing whether the person who helps them is going to end up in trouble or not.
And that's within the UK parameters,
that's right.
legal
that's
parameters.
Where guidelines come in, whereas we need a change in the law to make it very clear whether a prosecution will be there or not.
But we know in the Irish system that the legal sanctions are there very clearly.
Yes, but at the same time, they've been muddied to a certain extent by our case, on the basis that the court specifically said that they felt certain that the DPP here would use the same guidelines. Now, one of the things we asked for was guidelines to be issued by the DPP, but the DPP refused. But the court said that they were sure that the same guidelines would be used. But not long after that, Gail O'Rourke was charged. Now, Gail O'Rourke satisfied every part of those guidelines in the UK. So why was Gail charged if the DPP here was prepared to use the same guidelines as the UK? So that's what I'm saying. It's been muddied even further here.
I just want to ask you about, regulation going forward in Ireland, and you talked about that kind of UK framework, and obviously Tom mentioned it there as well just a few moments ago. But it is a case, though, that the Irish, it is a case though, Michael, I should say, that it's actual legislation that would have to change if it was something that that members of the Oireachtas were ever going to look at into the future.
Well, yeah, but the legislation will have to change in order to catch up with reality. It's not a case that you're not having assisted suicide. It is happening, and people who are terminally ill and their loved ones will act in accordance with their own conscience rather than the law, even law-abiding people. So the law does need to change, but it needs to change in order to regulate whatever is already happening, not in order to create a new situation that something that isn't happening is going to happen. Now, we attended the Oireachtas Justice Committee when it was discussing this issue recently, and we found that they were quite sympathetic. We thought, that those who are on the committee and are looking at it, and it's that when people do actually examine the issue, they come to the same conclusion that it is the right thing to do, it's the ethical thing to do. But the
There's
difficulty
still people though that just wholeheartedly would disagree. There
are, they're largely people coming from two perspectives. One is from a religious perspective, but ultimately the state has to remain neutral on religious issues because there are so many different religious beliefs. Everybody is entitled to act in accordance with their own religious conscience, but the only way for the state to protect equally everybody's right to do that is for the state to not act in accordance with religious beliefs. And the second issue is the one of palliative care. That's the strongest argument that is put about that palliative care is an alternative option, and it is there as well. And we strongly support that. We support that there should be the right to palliative care. But I think it is inevitable that it will change. This is the direction that society is going.
Just in summary as well, just Gina and Tom, do you agree with Michael on that? Is there a desire or an appetite to relook at this issue?
I think when people are confronted with the reality, the personal reality or of a close relative, I think they do look on everything in life, through a different lens. I would like to see how the guidelines in the UK have panned out before I went to a full legislative situation, because it is interesting that very few countries have actually legislated for it, albeit the guidelines. So I'd like to I think if we had those guidelines, and I know the case Tom was talking about, where, there were no guidelines that had been agreed, so I think that was why that woman was initially prosecuted. I suppose to help the discussion, I was just going to mention two things. There's a lot of good movies that are very deep and insightful. One is it is a Spanish one, Mar Adentro, The Sea Inside, about this young man at 17 who dived off a rock and became a quadriplegic. And at 40, he decided he wanted to die. The movie is beautiful. It's slow. It's meditative. It's reflected. And I've forgotten the name of the actor, but he's one of the gurus at the moment. It's not a new movie, a few years old.
It might not be academic reading or viewing.
No. It's beautifully done. I mean, and there's a very strong love element. And the other one that I think is closer to home is there's a doctor, Dr. Anne Turner. She was a UK doctor, and she was diagnosed with a condition called supranuclear palsy, which is pretty rough. And her husband had died, strangely enough, of a similar condition. She wanted to die. She wanted to go to Dignitas. And it's a docudrama by Frank McGuinness. It is absolutely superb because he looks at every angle of it. And her own family were utterly opposed to her going to Dignitas initially, and she did go and she did die there. But it plays out, all the elements, all the emotions, all the debate, all the rationality, all the different aspects of it. And I think that's kind of that needs to be seen by more people.
Well, I suppose today is really about having a conversation.
To begin the discussion.
People can make up, obviously, their own mind. Just, Tom, the final word to you today. Do you see, I mean, obviously we're over 10 years on from your own legal challenge to this, but do you ever see a change?
Yes, and Michael mentioned earlier on that the Oireachtas committee, the joint committee, that was just the end of last year, and they've since produced a report recommending that this is something that should be put on the cards for discussion, and they've also recommended that it should be sent to the Citizens' Assembly. We don't have a Citizens' Assembly, and there would need to be several other things for them to look at before a Citizens' Assembly could be assembled again. But they were very favourable as far as looking at this issue, and they said that it is probably a moral issue that we're going to have to face up to sooner or later. and the sooner the better.
My thanks to you all for joining us today and for giving us lots to consider. Our panel today, the Director of Exit and European Coordinator Tom Curran, Gina Menzies, Lecturer in Bioethics and Theologian, and also Michael Nugent, the co-founder of Right to Die Ireland and Chair of Atheist Ireland. My thanks to the production team, Aidan McKelvey and Stephen Jordan. As always, you can listen back to the podcast on newstalk.com or on iTunes or any other podcast player. Bobby Kerr is up next with Bobby's Late Breakfast. I'll be back again next Sunday morning from 8. But for me, Andrea Gilligan, have a great day.
Between the Lines on Newstalk.